Hello, good morning, good evening, everybody. Welcome. I'm Dr. Asavari Manavikar. I would like to welcome you all to the CAR, Council for Ayurveda Research, Global Webinar Research Series. Council for Ayurveda Research is an international non-profit organization which is based out of USA. And it has its own sister chapter in India by the name of Ayurvidya Anusandhan Abhiyan Foundation, AAAF. Our mission is to encourage, educate, and facilitate basic disciplinary and clinical research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. No nonprofit can operate and succeed without volunteers. So please consider joining us as a volunteer, and we can place you in a variety of projects based out of your skills and also your interest. Once again, our website is www.ayurvedaresearchusa.org. Again, thank you so much, everybody, for joining us today. Now, let me introduce our eminent speaker today. She is Vaidya Shilpa Yerme Patil. Namaste, madam.
Namaste.
She is a founder of Ayurveda Welfare Foundation, Solapur, Maharashtra. She is Secretary of Association of Kriya Sharir. She is a chairman at Solapur District Nima Teachers Forum, working as a professor in Kriya Sharir Department in SGR Ayurveda College, Solapur. She has profound experience, more than 20 years of teaching. She has done her PG diploma in medical education, that is Ayurvedic medical education. She worked as a college coordinator, deputy superintendent, chairman of society at SGR Ayurveda College, Solapur. She is entrepreneur, motivator, international speaker, and she has delivered guest lectures on various platforms. She has been working on editorial board, member of research journal, Ayurlog, Ayush Darpan Journal, JAIHM. She has published textbooks as per MUHS syllabus on Kriya Sharir, which are approved by MUHS University. She has profound experience of teaching research methodology and medical statistics. She has published book on research methodology and medical statistics for UG as well as PG students. She is the editor of book Therapeutics in Gynecology. She is the editor of book Obesity and Ayurveda Approach, and she has contributed chapter in a book related to PCOD, obesity, therapeutics in gynecology. She has published book on food for dosha, and it is an international publication, so you everybody can be able to read that book. She has taught thousands of students about Prakruti, Dhatusar, and its clinical application. She has published e-books on Prakruti, Dhatusar, infertility, Shlokavali, and Tridosh Prakruti. She has organized a number of virtual conferences and Samhita sessions. She regularly publishes and writes in different magazines as well as newspapers. So it is very nice to have you today, and I would like you to take it from here.
Yeah, thank you very much, ma'am. Good evening, namaskar, and good morning to all Dr. Patankar sir and all the senior doctors present over here. I am actually, my PG subject is Kriya Sharir, but right now I am working in the field of gynecology too. So I have taken here just the cases of which are from the gynecological, my experiences, and I conduct a regular basis from last 2.5 years. I conduct regular online gynae group I run a gynae group, and this group is on Ayurdarpan platform, which is from Dehradun, and number of doctors, Vaidyas are there from all states. So with that, my experience, I'm sharing few cases. Case number one, patient come with mood swing. She was confused. Her memory was disturbed. Somehow feeling fatigue, irritation, and the age is 47. After examination, after detailed history taking, the blood pressure, pulse was normal. And I advised a routine CBC, routine checkup. Her menstrual history was like that. The last period was before 2 months, which was irregular somehow. Uh, at that time, I thought that this may be a menopausal findings. Her stool and urine were normal. Little constipation, I noted a little constipated. The patient was having little constipation from last 2-3 months, but that was not a big issue. Many times the condition is maybe due to lack of some fluid or lack of nutrition, or it is according to Ayurveda, it may be due to the vitiation of the Vata dosha. As I thought that she reached her perimenopause stage, so advised her to do as a routine part of investigation at the age of 45 to around 50 pap smear initially. And initially, as per Ayurveda recommends, we do consider Am and Agni concept. And with that concept, usually, actually, in gynecology, I thought people very occasionally use this Deepan and Pachan. In Kai Chikitsa or in routine practice, like Panchakarma and Kai Chikitsa practice, the physician always prefer such type of Deepan Pachan. But I observed that in some states, there is no concept of Deepan Pachan. But as we are studying, it's really a fortunate as we are studying in the Maharashtra, and where the Ayurveda culture is having its own glory. And that point of view, I started Rasapachapati 2 BD for 7 days, Trikatu Churna 500 milligram with warm water for 7 days, Arogyavardhini 2 BD 7 days. Rasapachak, this is the concept of pachan. That means it facilitates the digestion process. As we know that initially the rasa dhatu is the adya dhatu, and if the rasa is formed at its pure form or as it is in the normal stage, the other dhatus will in the better condition. So rasa pachak, the concept of rasa pachak is again here with as artho and stanya. These are two upadhatus of rasa dhatu. So initially the patient is at perimenopause. Actually, menopause is a condition. We thought that it is a vata dominant, but actually, as per according to the dividation of age, the up to 55 to 60, the age is of pitta dominant. So in menopause, it's like vata and pitta dominant stage. And if we consider Agniman or arm formation, I think Rasapachak will work better. And so Rasapachak advised in these symptoms. Trikatu Churna itself act same way as a Deepan and Pachan. Arogyavardhini, it works on the Rasa Dhatu and it clears the arm and all Dhatu's channels. So Arogyavardhini, we prefer in variety of number of cases in gynecology, in Kai Chikitsa, Arogyavardhini is like a preferred combination at first stage. After all these medicines with first follow, I observed that a patient also noticed that there is a little improvement in digestion. So next plan of, I thought it is better to go with Virechan. So as according to our classic, I started Snehapana with Triphala Gruta. Triphala, I think Triphala will be the better choice. Tridosh Shaman. So Triphala Grut 20 ml. in the Vardhaman Matra for 3 days. That means 20 ml, then 40 ml, and then 60 ml for 3 days with warm water. On 4th day, Abhyanga with sesame oil. And on 5th day, morning, Tivrutta Avleyaho, 50 gram with warm water for virechan purpose. Patient noticed around 15 Vegas. After that, after virechan or after passing out all these Vegas, she was very much tired and feeling fatigue. So rest is much needed at that time also with Sansajan Krama, because Ayurveda concept is that after any type of Shodhan, patient must go with all Sansajan Kramas at least for 5 days. If patient prefers, it may be prolonged up to 10 days or 15 days as per the choice. But in today's era, it's not possible to go with all such type of preparations. Pathya Kalpanas, Yush, Mandapeya. It is not possible if patient is working. So simply I suggested moong, yush, rice water, and in India or in Maharashtra, we prefer the jawar roti. So jawar, yush, I preferred, lajamand, and the next plant with this, after completion of the total procedure of virechan, the next plant I added Saraswatarish. Saraswatarish is a better option in such type of mood swings and mental confusion, somehow to boost the energy, to boost the mental power. It works on the Dhruti and Smriti. So Saraswatarish is better condition in the perimenopause. Amlaki Eshtimadu with warm water, as Amlaki is Rasayan, and Eshtimadu is also having a great effect on this. So Amlaki Eshtimadu with warm water, Bala Shatavadik Shirpak, as we made, as we prefer this Shirapaka Kalpana. I always prefer this Shirpak because I think this is the best way to give the Rasayan drugs in combination with the milk. As we boil these drugs with milk, they are better absorbed, and all the sattva, all the sar of this Bala and Shatavari get very much properly mixed with this Shir. So Bala Shatavari Shirpak was advised. Then, as this is a Pitta dominant stage, and for such cases, I always prefer Shitali Pranayam, which acts on the Pitta dosha. And Shitali works very best in all such type of perimenopausal condition, or whenever there is a dominance of Pitta dosha. I always suggest Shitali Pranava instead of routine Anulom Vilom, or you can suggest with the Anulom Vilom to this Shitali Pranayam. So this just the conclusion or the diagnosis made is perimenopause. After follow-up of 15 days, the patient was very happy with the better improvement. Appetite was good. Patient was feeling fresh and with mood elevation. And so the next plan, of course, I continued Saraswatarish for better performance or for better results. Shirpak also continued, and I added Draksha. As just now I discussed that this is menopause is a Vata dominant and Pitta dominant stage. So Draksha as Madhur, Shita, it will work on Pitta dosha, and as all type of Avleyaha, like Brahmi Avleyaho, Chaunprash Avleyaho, Dadima Avleyaho, Bhallatak Avleyaho. There are various forms of Avleyaha which are very preferred and they are easy to take. And during this perimenopause condition, I thought Avleya Kalpana will be the better choice. So I added this Draksha Avleya for next 21 days. And then patient, it was very much liked by the patient, and she continued it for next 3 months approximately. And as the diagnosis made is perimenopause, and so with 2 months of treatment, patient improved 75%. So this is a simple perimenopause case. Sometimes such cases are not come up to the clinics. But I think that perimenopause should be treated. Menopausal symptoms are found in variety, like some women feel or some women are with very much normal conditions, no any much problematic symptoms are there, but sometimes perimenopause may be panic or maybe it is painful to patients. So this is my first case. I usually prefer very simple drugs or whatever available in your OPD. You can go with all such drugs. Case 2, the chief complaints were pain in perineal region from last 1 month, age 38 years female, history of constipation. Her menstrual cycle was regular. Initially, she is having 2 children and tubectomy with tubectomy. On examination, her pulse or nadi was regular, BP also regular, local examination, nothing specific noted after local examination. Her prakruti was Vata-Pittach, and after taking the detailed history, the diet pattern I found is that dry food, spicy food, frozen food. She eats on regular basis, meat, fish, and day sleep. Her tongue was coated. After examination of abdomen local, per abdomen, tenderness was noted. I advise her routinely the CBC and urine. Further treatment plan as per I just now told about the Pachan. And so I prefer Am Pachak Vati for 5 days, 2 BD in the dose of 2 BD with warm water. The Shmularish, as initially I thought that all the symptoms were related to Vata dosha, and for Vata dosha and the pain, initially for pain, I preferred Dashmularishta 15 ml after food, Chandraprabhavati 2 BD. Why Chandraprabha? I think Chandraprabha is the best option in all conditions of reproductive system and urinary tract infection. It works better in all urogenital problems. So Chandraprabhavati advised 2 BD for 15 days. After 15 days of medicine, Ampachakati for 5 days, the Shmolarist for 15 days, and Chandraprabhavati for 15 days. In the first follow, her motion was improved. A little bit improvement was noted. Tongue, somehow it was normal. Pain, 20% of pain relieved with just Ampachak. So I think Ampachakvati, even in many cases, I noted that after taking Ampachakvati or after taking any type of Pachak Kalpa, the pain is relieved. 20, 30, 50% pain was relieved. It is noted. I often found such notings, such relief from patients that after Ampachan, the pain is relieved. Next, as the local pain was there, perineal pain was there, I think Yoni Pichu is the best option for such condition around the age of 40. She's entering in the perimenopause. So next I planned Yoni Pichu as a local treatment. Yoni Pichu is the best option for Vata dosha. And here as Pichu of oil, or which is like 10 pounds soaked in oil or ghee, whatever preferable to you, whatever preferable to patient and doctor, as per the need or as per the dosha dusha samochana, as per the saprapti ghatak, Yoni Pichu with Dhanvantar oil. As Dhanvantar oil is the best option for Vata and Kapha dosha samurchana, or for Vata Kapha dominant lakshanas. Yoni Pichu is a simple procedure in which sterile gauze, which is soaken in the oil or ghee, it is inserted in the yoni, vaginal orifice for 30 minutes or 45 minutes. And this is the best plan, or this is the best option for Vata dosha, as we all know that Apan Vayu governs all the Adho Udar, and it governs all the functions of the reproductive system. So it is best to work on Apan, correction of Apan. Falagrut Pan, again I prefer always, it is my favorite combination to use Falagrut. As Falagrut, though people thought or women thought that Falagruta is only for infertility cases, but it is not that. Falagruta acts in every condition. Even you can give in the late menopause too. Falagruta pan as a sneha, but as Falagruta is the best option, or it works very well in the vata and reproductive system, any type of problems. So Falagruta pan 10 ml with warm water. Sneha pan, so simply if you offer any type of ghee, if even though homemade ghee is preferred for all such type of vata related issues, only sneha pan, if you prefer only sneha pan, it will definitely work. At least 30 to 40% patient symptoms will be relieved. Falagruta pan of 10 ml, then Chandan Bala 101, which is the best option in Maharashtra. This Chandan Bala 101 capsules are available, and which are best preferred for any type of daurbalya, fatigue, thakan, and any type of anemic type of feelings. Chandan Bala, Chandan and Bala. So Chandan, which works on Pitta dosha, and Bala, which works on Vata dosha. So ultimately, Chandan Bala is the best option for any type of Vata joint pain, any type of spinal disorders. It nourishes the Vata dosha, it boosts the nervous system, it boosts the joints, it boosts the Asti dosha, Asti dhatu. And so, Yoni Pichu with the Dhanvantar oil for 10 days, Falagruta pan, 10 ml daily, Chandan Bala 101, 2 BD. After Pichu, it's really, I'm just happy to share the views. After just Pichu, with 10 days Pichu, the pain relieved, 70% of pain is relieved with only Pichu. And the motion was clear, appetite improved. So this, I just want to discuss this case because it is a case of simple uni issue. It is in our, as per our text or as per Charak Sanhita, it is Vataj Yoni Vyapar. It can be correlate as a Vataj Yoni Vyapar. After this all treatment protocol case, this is a simple, I found that this is a case of simple Yoni issue. And Pichu, I just want to present my views about Pichu, that Pichu worked well as it absorbed in the perineal tissue. And Snehan is the ultimate or best option for Vatashama. Pichu, when we insert such Pichu in the vaginal orifice, it is absorbed in the all the vaginal flora with vaginal tissues. And this is the best way to feel or to get mental relaxation. I always believe that Garbhashay and mind are very closely related. See, we often found that if the sattva is in its own proper, or it is it in its own normal way, or when the mind is cool, mind is relaxed, all the functions, that is pregnancy, whatever the reproductive functions are there, like menstruation, pregnancy, or menopause, all these are related with, especially its connection with the mind and Garbhashay connection. Whenever we perform any type of function, any type of modality, any type of treatment with Garbhashay, it ultimately works on mind. As we all know that mind-body relationship. But especially, I noted that whenever we put this Pichu, ultimately it soothes the mind. So this is the best way to connect the mind, because in women, I often observe that women's, God even understand what is there, what women feel at every moment. So for mental relaxation, for or any type of Vatach condition, Yoni Pichu works very well. And with this simple Pichu and Falagruta pan, Sneha pan, this case, I remember the patient, for the first day of patient, she came with the pain, and after just within 1 month, the pain was relieved and patient was very happy. And again, I advised her all other diet plan, Vata Shamak diet. I suggested her to take daily Sneha in any form, like ghee, oil, whatever she prefers. So Snehan is much needed in any type of vata patient. Case 3, this case I have just published in the international journal, UGC Care Journal. I have just published this case of Garbhashosh. I, I have just came up this case with in detail. But 29 years pregnant woman with complaints of restricted growth and durbalya. After detailed examination and history, routine investigations like blood, urine were advised. Menstrual history, last menstruation was before 6 months. Menarche is at age 11 years. Age she got menarche. Earlier menstruation was regular with 3-4 days of bleeding. Married 9 years ago. Second gravida, one girl child of 7 years with normal delivery. Family history, nothing special. General examination, patient was fair. The general condition was fair. Built, moderately built. Height, 5 feet. Weight, 55 kg. Nourishment was moderately nourished. Pallor absent, edema absent. Nails, no clubbing. Cyanosis absent. Lymphadenopathy absent. Pulse, 78 per minute. BP, 110. 78 mmHg. Systemic examination. Respiratory system was clear. CVS heart sounds normal. Per examination, uterus relaxed, fundal height approximately 24 weeks, FHS 136 beat per minute. Diet vegetarian, Shuddha normal, Mal normal, Mutra normal, 6 to 7 times a day. Nidra, sound sleep. Rogi Pariksha. Her Prakriti was Pitta Vata, Vikruti, Dosha, Vata Dosha. Sar, Madhyam Sara, all SARs like Rasa Rakta, Mouse Meat, Madhyam Sar, Sahanan Madhyam, Praman 5 feet, Sattva Madhyam, Satmya, Sarvarasa, Ahar Shakti Madhyam, Vyayam Shakti Madhyam, Vaya Madhyam. Laboratory investigations, hemoglobin, it was okay, 10.5. Blood group A positive, RBC count 4 million. Urine examination, urine albumin absent. Serum protein 5.6 gram DL, albumin 3.4. No pus cells. In USG, a single intrauterine gestation of 24 weeks, 2 days with 1200 gram weight, and CPR is just below 1, showing IUGR. After detailed history, the Nidanas like Vata Prakop, Katutikta, Lagu Ahar Sevan history, Atishram, Chinta, Samprapti Nidan Sevan leads to Vata Prakop and upward movement of Vata, which dries up the Garbhashay. Upashay with Ushna Dravyas, Anupashay with Sheet Dravyas. Treatment protocol. Actually, as the cases of IUGR, initially the rest is advised to patient. Hetu 7 avoided. Hetu 7 means I just changed the diet plan. The first course or the first line of treatment, Ampachan with, because this is a case of IUGR with, and patient is in Garbini, so somehow mild type of Ampachan I just wanted with Jirak and Jala. In Ayurveda, there are number of Panak Kalpana. I always suggest my patients about the simple homemade Panak Kalpana or Fant Kalpana. You just take 1 teaspoon of Jirak and soak it in the hot water for 2 to 3 hours. After that, just to smash, and with by filtering, you can easily, patient can take. It is very easy to make, even for pediatric. I prefer this simple remedy, which works very well for any type of abdomen pain, discomfort, because we know all that Jirak is a spice, Indian spice, and which works on Agni. And Jirak is ultimately a good Stanyavardhak spice too. So after delivery, even in Sutika Avastha, we prefer Jirakadhyarishta, Jirakaulayah, Gud Jirak, Jirakadimodak. All such preparations works very, very well on Rasa Dhatu. And as the Stanya is the Upadhatu of Rasa, it is best to apt this simple Ampachan Khazur month, as we know that Khazur is a rich source of iron, and Khazur it is available, easily available, and it is sweet, tasty, so consumable also. Khazur month once a day. Madhumalini Vasant. We always prefer Madhumalini Vasant in the Garbhavastha as a normal routine. Garbhini Paricharya, Ashwagandha, Bala, Jeshtamat, Shirpa. Again, Shirpak is the best option because uh, as we go with boiling all such drugs, boiling with milk, and it's easy to make, it's fresh, we can prepare freshly 2 times a day. So Ashwagandha, Bala, and Jeshtumat Shirpak for 21 days. This is initially the first course. After that, in the second course, Madhumalini Vasant again continued 2 BD for over time. Bala, Shatavari, I added now Gokshur. Actually, Gokshur is indicated in the Garbhini Paricharya. There is from Charak and Sushrut, Gokshur, Siddha, Dugdha is indicated. As we know that Gokshur is a great antidiuretic, and women often suffer from the edema. So for that purpose, also Gokshur is needed in Garbhini Avastha. Bala, Shatavari, Gokshur, Punarnava is also, it works very well in Shof inflammation condition. Shirapak for 21 days. Now I added Vidari Gurta. Vidari is the best Balle drug, Jivani Gana. So Vidari Guruta, 10 gram once a day. In the third trimester, because it is not suggested to give Basti, but I think nowadays I heard that many of the gynecologists, Ayurvedic gynecologists prefer Matra Basti even frequently. Every month they prefer Matra Basti of Chandan Bala or Kshir Bala, Ya Bala, Ashwagandha. So Matra Basti, I started Matra Basti of Chandan Bala, 50 ml Matra Basti thrice a week. As the patient is in next stage, so I thought Matra Basti would be the best choice, thrice a week. Mans Rasa Sevan, advised to patient for 15 days as for the Mans Dhatu, Samanya Dosh, Samanya Vishesh Siddhant, Saman se Saman ki Vrutti. And so that here again, Mans Rasa Sevan is advised for next 15 days in this case. After first course of 21 days, patient feeling better. Her weight increased by 1.5 kg. Fetal weight 1500 gram. Single live fetus with adequate liquor. During another 2 courses, patient's condition improved. And after total course, in the last month, observations are as fetal weight 2.2 kg, mother weight 61 kg, no fatigue, no back pain. As see, no back pain, no fatigue. It is due to, I think it is due to Kshirapak Kalpana. It is due to Snehapan. It is due to Vidari Gruta, which works best. Patient was feeling fresh and enthusiastic too. So I think in Garbhashosh or any kind of IUGR, because I often see the prescription of gynecologists, other doctors, that they give some type of vitamins, minerals. Dose of minerals and vitamins are much frequently preferred. But Ayurveda has its own kalpanas like Shirpak and Dhutta Kalpana, which works very nicely in nourishing the dhatu. And so in Garbhashosha, it is due to the deficiency of nourishment to the fetus, and the causes of IUGR can be maternal, fetoplacental, and unknown. Sometimes they may be unknown causes. Emaciation or dryness is due to Vata. Vata is mainly responsible for Shosha, and in this condition, Vata Shama. See now, what we do, we must go with Vata Dosha, Vata Shama, Rasayan, Agni Dipan, Bruhan, Dhatu Poshan. Dravyats work very well. Hingu, Dadi, eggs in Madhumalini Vasant acts as Balya. Rasayan, Khazur is a Dhatu Pushtikar. Ashwagandha, Bala, Jeshtomat, Gokshur are good as Rasayan and Balya. Vidari Adi Grut is beneficial as Vidari Kand is from Charakokta Jivani Gana. I think this Charakokta Dashemani gun. If you have only this Dashemani gun, 50 gana, you can practice very well without no other drugs. So Dashemani gana, as Vidari is from Jivani, it is beneficial as a Jivani Dravya. And with this, all three cases, actually, just now I told to Madam also, ki I work much in Prakruti. These are my all applications which are available on Android mobile. Prakruti calculator, you just download it and go through the questionnaire. The questionnaire is in Marathi and English. Just there are around 48 questions. You just say yes, no, whatever you feel about your Prakruti or whatever the questions are available, like your build, height, diet pattern, your sleep pattern, memory pattern. Again, one more interesting e-book is there, Dhatu Sara, about Dhatu Sara. I think we often discuss about Prakruti, but Dhatu Sara is somehow not discussed much. But I take classes on Dhatu Sara and I taught this Dhatu Sara very differently, and even though Prakruti. In Dhatu Sara, I have added advisory diet regimen too. So if you get your Dhatu Sara like Uttam, Madhyam or whatever, like if the person is having Asti Dhatu Asarata, then there are preferences for diet too in this application, which is e-book type of application. As I have experience of teaching research methodology, my book is also available and it is also in the app form. You can easily install in your mobile and you can use it. With this, thank you very much for this opportunity to share my cases. As I am not well, so I have not prepared much, but whatever I have, I just shared with you all. Thank you very much. Thank you, ma'am.
Thank you so much for such a wonderful webinar and great lecture and sharing all of these cases and your clinical experience with everybody. And each case is unique, and the way how you said is so true, because in Garbhini as well as in women, actually, Vata needs to be controlled, because with the today's lifestyle, there is so much Vata aggravation, lot of stress, lot of activities all the time for everyone. So Vata dosh as well as looking at the Rasa Dhatu, because if you look at, Stanya as well as Raja, both of them, they are related to the Rasa Dhatu. So the cases were really interesting and you explained it so well. It will be definitely helpful for everybody in their clinical practice as well.
Thank you. Sir, namaste. Dr. Patankar, sir, namaste.
Namaste.
Will explain as usual, I should say. One more thing I want to add. What is your approach about the counseling of in such cases, and along with their husband or family is also need of the hour. That's what's my opinion. But you are expert in gynec. But these are my views and what I've seen in 36 years of practice. So please share your experience also about the counseling, and not only counseling to those women who are suffering from these things, but for her husband and for her family. That is also needed.
Yes, sir. Of course, family support is much needed, and I think during the all stages of life, during pregnancy or in Sutikavastha, in menopause, the partner's role is much important, and I think we must go with such counseling. And in menopause, it is much needed because the menopause is really worsening in some women.
Yes, yes.
And the family disturbs with her mood swings and with all her choices. So and one more thing I just want to add, that we must, if time prefers or if it is allowed, we must counsel her kids too, because
Yes,
as they are
correct.
younger or teenagers,
Young,
kids
yes.
are there. So women in menopause,
Yes, yes.
her children's maybe in teenage. So with
Correct,
that
correct.
teenage children's, we must
Yes.
tell them to adjust with her, to cope up with her feelings,
Correct,
to
correct,
be
correct.
her. Yes.
Because I think so, at that age, woman feels that she is completely free from her all activities, but need to some attention from, as you said, from her children and from her partner also. So understanding between them is a must.
My
Yeah.
new book is coming, sir, on this Diwali, menopause. My favorite topic, menopause, and
Okay.
I'm doing PhD, and my topic is that effect of mantra chanting in menopausal mild depression. So
Great.
I'm doing this mantra chanting on menopausal depression. So menopause is my favorite topic,
Favorite,
and my book
favorite
is
topic.
coming, just a menopause guide, a little book of
Okay.
100 pages with
Okay.
all shades of menopause.
Excellent.
Wonderful. Such an important topic.
Yeah.
Yeah.
Or in India, it's
That's
not,
very
ma'am. It's not like that. Ki there are separate clinic, menopause clinic. In maybe in US, it is the concept of menopause clinic, but in India, it is not much preferable topic.
Not at all.
Not at all.
right, right. It is such a big
Nobody
transition.
wants to speak on menopause.
Correct.
Everyone
Right.
wants to speak on garbhini, pregnancy, and childcare, but no
Correct.
one wants to discuss about menopause.
Yeah.
And
And
see
it's
now,
the biggest
men are,
transition.
yes, transition. And woman lives with this menstruation for around 40 years. And after that, she totally, with no menses, she was not comfortable at early years. She feel like very much loneliness. हम जैसे बोलते हैं ना कि कुछ खालीपन लग रहा है, कुछ
Yes.
miss,
Correct.
she miss her period actually. Because with 40 years of that binding.
Right, right, right. Very true. And even the perimenopause, because perimenopause can be really so prolonged. And that condition women are not aware of. And there needs to be definitely awareness that need to be created. Because why she is going through those changes or why she is feeling the emotions and things which were not there before. The things which were so straightforward, why those things are changed now. Physically as well as definitely emotionally.
It's actually the transition period in every means, life changing part, relationship changes are there, society awareness, yeah, society, cultural changes, socio economic changes are there during the menopause. Yes, sir, please.
We were very lucky. We had such a expert gynac was our teacher, Vaidya madam. He used to tell us, while looking at the woman after 40 or 42, you must look at her thyroid glands, then breast glands, and then uterus. And in these conditions, as you said so, perimenopause, menopause, and postmenopause, these three terms are most important for each and every woman and must be taken care of a good Vaidya from all the sides, as medication, as counseling is need of the hour. I think so.
Yes, yes, definitely.
Very true. Very true. Yeah. Anybody has any thoughts or any questions? Okay. All right. So thank you so much for attending our webinar. And thank you so much, Dr. Shilpa, for taking the time to talk to everybody and sharing your wonderful experiences in the gynecology. So please watch and subscribe our CAR YouTube channel so that you can actually, look at previous presentations and other topics. So please like, comment, and share the videos. Once again, I invite you all to become a part or a member and also fill out the volunteer form. You can now also subscribe to our IU update. So it's a newsletter that goes on. So please also subscribe that to stay tuned with our projects as well as the events that we carry time to time. So if you have any questions, feel free to contact us at ayurvedaresearchusa@gmail.com, or you can also email me. My email ID is asavari@mnayurveda.com. Right. Thank you so much.
Ma'am, is there any Google form to join with this card?
Sure, definitely. I will send it to you. I mean, you can also
Okay, I will
share
join.
it with
Yeah.
other students and everyone.
Yeah, it will be good. Yeah, it's my pleasure to join with this such a nice association, and thank you very much, and all the best for your future endeavors. Yes, thank you.
Yep.
Excellent.
Thank you,
Vaidya.
sir. Thank you for this
Thank you.
opportunity. Thank you.
It's always nice to see Patankar sir.
Arey
Yeah.
wah.
He's so
Okay,
active.
My
Sir
pleasure.
is so active, and sir always joins and motivates. Yes.
Absolutely.
Thank you.
Thank you.
Okay.
Happy Navratri
ma'am.
to everybody. Yeah.
Yes, yes. Same to you.
Same to
Thank
you.
you.
Thank you.
Okay.